Thank you very much. It's a great honour to be here today. If you'll permit me, I'd like to start by congratulating the team who worked on this. I think they did an excellent job. And by thanking the Commission, because I think the Commission's engagement with us was very constructive and professional throughout the process, even when we were not entirely convinced by all the actions they'd taken. I think they did a fantastic good job at engaging with us. I was hoping we'd have a... Yeah, good.
I think you have to have it the other way around.
The other way around?
Yeah.
Good. This is, as it's a relatively new Parliament, it's just a reminder of the role of the European Court of Auditors. We're, of course, involved in checking the accounts, performing performance audits, giving opinions on proposals. I'd like to specifically address the last point. I'm the director of the Chamber, which is responsible for looking at the sustainable use of natural resources. We take a great interest in your work here, and indeed, listening to the last discussion, I was reminded that we produced a report on food safety, looking at the chemicals issue earlier this year, and that we have in progress at the moment a report on pesticides, so I hope they will also be of interest to the committee. And I and my colleagues will be back later in the day to listen to Commissioner Vela, because we also have some work underway under marine diversity. So we take a great interest in your work, and we hope it's relevant to yourselves. This was a report that looked at an area where the Commission and EU legislation are really quite ambitious, and really sought to achieve some significant and difficult to achieve issues. We looked at the implementation of the cross-border health directive in the Member States. We looked at the results achieved so far in terms of cross-border exchanges of e-data, which is something mentioned in the directive, but I think a project which goes back 10 or 12 years now, so a relatively mature project. And also EU actions on rare diseases to see if these add value. And again, that's something which dates back in total about 10 years. Now, this is probably a difficult to read diagram, but it's there to just to give an illustration of the complexity of what is trying to be achieved. These show, as best we have them, that the figures for the flows of patients from one jurisdiction to another under the directive. There's some limitations on the figures, of course. I think for the figures for France, which makes up 2/3 of the outgoing patients, I think they're not actually able to distinguish between patients moving under the directive and people moving under the Social Security regulation. One or two member states don't provide the figures, but in total you see that there are some really complex movements to be dealt with here. One or two clearly significant bilateral movements of patients, but a difficult thing to deal with in terms of procedures, but I think possibly above all in terms of IT. This is what we looked at. We looked at the Commission's monitoring of the directive. We looked at what it was doing to facilitate the exchange of patients' health data across borders. And we looked at the initiatives taken for rare diseases, in particular the creation of European reference networks and the EU-wide platform. Here's an overview of what we found, and I will move over this, I think, relatively quickly. But if I had a more ambitious presentation, I could probably put a big green tick across the top one. A little bit harder to put a big green tick against points 2 and points 3. I'll move on to explain what we found here. Information to patients on their rights to cross-border health care. There have been, since the directive came into force, many complaints that the information is is incomplete or is unclear to patients. I think that those are observations that this committee and that the Parliament took up in February of this year. We understand this. We think that the complexity of the framework does actually make it difficult to explain people their rights when there's more than one piece of legislation that might apply to them. Experts told us that they thought the national contact points could give much better information on access to European reference networks on the rare diseases, and that's something that we've reflected in our report. Our recommendations here are that the Commission should do more and should do more to support the work of the national contact points. We appreciate that there was the 2018 toolbox, which we think has been useful and a positive development in terms of making national contact points more user-friendly, more available to potential patients. But we'd like to see the Commission follow up on the use made of that. And we think the Commission ought to take seriously the suggestions by experts that the European reference networks should be covered by those national contact point websites and should provide some guidance on this issue. So those are our findings and those are our recommendations. On the second point, the cross-border exchanges of health data, here I'm going to express a personal sympathy for the Commission's predicament here, because I think if you think about those complicated flows of patients across borders, it's a very tough job to get this right, and it really requires state-of-the-art project management. We note that the Commission has not achieved what it thought it would achieve in terms of this, and in fact, at the time we finished our report, and I think possibly still it is the case, that actual cross-flows of data using this architecture uniquely go from Finland to Estonia. So let's say the widespread use of this architecture hasn't yet transpired. More member states than that are ready to receive data, but there are not many member states. There are in fact no member states at the time we finished our audit equipped to send the data that they were looking for. So not as successful as first hoped. And we think that the Commission was probably optimistic at the time of scoping this project and probably optimistic in terms of assessing how difficult it would be to apply. Now, in order to prepare for better cross-border exchanges of health data in the future, I think the Commission will need to engage an independent assessment of what it's done, and to assess whether these e-health actions have actually provided cost-effective and timely solutions and meaningful input to national healthcare systems. I'm aware that there are also some bilateral arrangements between member states, and given the importance of some bilateral flows, that's probably of great significance. Thirdly, I want to move on to the difficult and I think emotive issue of rare diseases. I think we'd all like to see great progress on this. The Commission has had an approach to this dating back at least to 2008. The ERNs have been the dominant strategy since 2014. They face significant challenges to their future financial sustainability. And indeed putting together these networks in terms of organising a process to screen the partners, assessing the work of those partners really does create some difficult administrative tasks. And we're not really clear what the future holds for these networks. They have a current funding framework which is not as clear as it might be, and where we're not sure what the future holds. So what are we looking for? We are really looking for the Commission again to assess the results of its strategy and to decide whether it is the right strategy to go forward with or whether it needs to be amended either marginally or more significantly. We think it should set out ways forward to address the challenges faced by the networks. And if the networks are to continue in something like their current form, it needs to have a simpler and more transparent funding mechanism. So to summarise, we see some progress in some of the significant areas of putting the directive into place. There's still quite a lot of work to be done. A lot of that is assessment and evaluation of the things that have taken place and an assessment of whether they are the right ways to go forward in the future. I was reading the Parliament's document on this dating back to February, and I find myself agreeing with the Parliament's conclusions that this sort of evaluation needs to take account of the quality of life outcomes for all these, for the patients involved. I hope that this report that we have produced is a useful input to that process and a constructive contribution to the debate. Thank you very much.